Good afternoon, guys. Today we're going to be performing a physical assessment on Juan right here. Here is his video release form, and now I'm going to perform a 360 scan of the room. Okay. That is the person holding the camera. It's the floor. Nothing on the floor and the ceiling. Okay. So moving on, I have washed my hands and applied some gloves, and I'm going to provide some privacy for Juan. Okay. So welcome, Juan. How are you?
Good.
Can you tell me your first name and date of birth?
My first name is Juan. It's January 20, 1972.
Okay, thank you. As we can see, the patient's mood is content. He seems to be following me. And now I'm going to ask you some questions, if that's okay.
Okay.
Do you know where we are?
Yeah, at home.
Okay. Do you know why you're here?
Yeah, for physical.
Okay. And do you know around what time it is right now?
It's around 2 o'clock, 2:30.
Okay. And can you tell me your full name?
My name is Juan Pardo.
Okay. So as we can see, the patient is alert and oriented ×4. So now we're going to start the physical assessment, starting with the patient's head. As we can see, the patient has no hair. He has signs of baldness around this area, and his hair follicles are distributed from the left temporal, passing the occipital, and going to the right temporal. The color of the face it's even. It is brown in color. No signs of trauma or any damage. The hair follicles are well distributed throughout the face as well. As we can see, the eyes are aligned with the ears. Sir, can you raise your eyebrows? So you can see the eyebrows are aligned as well. The nose is medial, and so is the mouth. Okay, now I'm going to ask you to pull down your eyelids a little bit more. Okay, as we can see, the conjunctiva of the patient is pink in color, no irritation, no discharge. The sclera is white in color, which is good. And now I will be performing the positions test. I'm going to ask you to follow the tip of my pen with your eyes only. Okay? Eyes only. Okay, patient seems to follow pretty well. No damage to any of the cranial nerves 3, 4, or 6. So now I am going to perform first, I'm going to evaluate your pupils, the size, and if they're equal or not. Pupils are around 4 millimeters in diameter, right and left, and they are equal. So now I'm going to perform a direct light test on you, sir. Okay, this is to evaluate the reaction of his pupils to the light. I'm going to place my hand right here, and I'm going to shine your left eye. Can you look over my shoulder? Okay. Okay. Patient's pupils contract every time with the red light. Now I'm going to do the same thing, but this time I'm going to be looking at the other eye. So once again, look straight over my shoulder. Okay. Patient's pupils constrict as well. So now I am going to examine you for accommodation. I'm going to ask you to follow the tip of my pen only with your eyes, as I will get it closer to your nose. Ready? Okay. As we can see, the patient's eyes accommodate pretty well. So now we're going to move forward with the mouth. As we can see, the patient's lips are pink, brownish in color. There's a little bit of dryness, but hoping that's okay. Sir, can you open your mouth for me? Okay, can you get the camera a little bit closer? Okay, as we can see, the patient has some dental work. Sir, do you have any fake teeth? No, patient denies. Patient has some fillings and I see a crown as well. Okay, now I'm going to examine the tongue, the throat, and the tonsils. Can you open your mouth? The tongue is pink in color, no signs of damage or discharge. I'm gonna place my tongue blade right over your nose. Can you say ah for me?
Ah.
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 Okay. Tonsils are grade 1, no irritation, no signs of damage. And so it's a throat, pink in color, no irritation or secretions. Okay. So, sir, now we're gonna move down to your throat. Can you please raise your neck? And is it okay if I palpate your neck?
Mm-hmm.
Patient accepts. No masses observed around the neck. I'm going to touch your trachea. Okay, the trachea is medial, and as well, no masses were palpated. So, sir, I'm going to ask you to face the wall. Well, can you move the camera over here? Okay. I'm going to ask you to raise your t-shirt for me. I'm going to palpate your spine, looking for abnormalities or masses. None. Any pain, any discomfort? Okay. Good. So now, sir, I'm going to auscultate you. Okay, every time I place the stethoscope, I need you to take a deep breath, okay? Okay, the lungs sound clear bilaterally throughout all the fields. Now we're going to do the same thing from your chest. Thank you, sir. I'm going to ask you to pull the shirt just a little bit more up. You could relax your arm. Thank you. Take a deep breath every time you place your stethoscope. Okay. Again, lungs sound clear bilaterally throughout all the fields. So now, sir, I'm going to ask you to lay on your back. And please pull your shirt up again. Okay, thank you. As we can see, the patient's abdomen is flat, no signs that the abdomen is distended. Are you experiencing any pain, sir?
No.
Okay, patient says he has no pain. The umbilicus looks clean, no secretions, no damage. The color of the skin in the abdomen is brown in color, equal in all quadrants. And now if you let me, I'm going to auscultate your abdomen. Okay. Starting here. Okay. Bowel movements are normal, around 7 to 8. No abnormalities were heard. So now, if you let me, sir, I'm going to palpate your abdomen.
Okay.
Are you experiencing any pain?
No.
Okay. So I'm going to start right here in the right quadrant. If the patient had any pain, I would start in the quadrant where the patient is experiencing pain. Okay, sir. You can pull your shirt down and you can stand up. So now I'm going to ask you to please pull your shirt just a little bit. I'm going to perform a blunt percussion to your kidneys. You can tell me if there's any pain or discomfort. Nothing?
No.
Anything?
Nothing.
Okay, you can pull your shirt down. Okay, and that concludes our physical assessment. You can have a seat. Ideally, I would turn the bed to the lowest position, raise 2 of the side rails, place the call light in reach for the patient, and I will go to my station and record the findings. Thank you.